For today's update, I'd like to answer some of the questions we've gotten about the budget recovery process from employees.
Hi, I'm Glenn Timmons. I've been here 25 years with the Security Department. What's going on with the budget recovery now?
As we communicated recently, we have organized 9 working groups to begin evaluating over 100 budget recovery ideas. These groups are approaching the ideas in a very thoughtful, practical manner. One of the things that they're doing is assessing the financial impact of these ideas, as well as the other impacts on the organization in terms of long-term consequence. As a result of their work, they are recommending to the steering committee which of these ideas should be considered budget recovery ideas and which should be considered budget contingency ideas.
Hi, I'm Bridget Rippey with the Respiratory Care Department. I would like to know what the color-coded system is.
We are using the color-coded system to help us prioritize our ideas. We are using the color scheme of green, yellow, orange, and red. Green ideas are considered budget recovery ideas and will be implemented regardless of what is happening at the state and federal levels. Yellow, orange, and red represent budget contingency ideas that may be implemented based on what happens with the state and federal budgets. One of the reasons that we've broken the contingency ideas into yellow, orange, and red is the fact that these ideas have different impact on the organization, some more painful than others. And one of the things that we want to be sure of is that the most painful choices are left to the end when we've exhausted all other options.
Hi, my name is Sally Cole and I'm an RN, and I would like to know how we're going to track ideas.
We'll be tracking our progress through the use of a dashboard which shows the dollar impact of our ideas in the green, yellow, orange, and red categories. In today's dashboard, what you'll see is that so far, our green ideas represent over half of what we need to reach our $85 million goal. We feel very good about that given where we are in the process. You'll also see that with our contingency ideas, yellow, orange, and red, we can close the gap between where our green ideas are and where we might need to be on September 1st. Obviously, we would like to not have to implement any of the budget contingency ideas. So we're going to be evaluating additional ideas that we might consider green as we move forward.
Hi, I'm Valerie Munoz, a nurse on C8. I'd like to know what's in the red idea category.
Among the red ideas is a workforce reduction that is equal to 5 to 10% of the workforce, or approximately 250 to 500 employees. Now, this would obviously be a very serious and significant step for the organization to take. I've been in organizations that have gone through a workforce reduction, and the toll is tremendous, not just for the employees that leave the organization, but for those that remain. That is one of the reasons why this is a red idea. This represents among the most painful things that we could possibly do at Children's Medical Center. So we are committed to ensuring that this is one of the last options that we will consider as we go through this process.
I'm Kelly Blair. I work in physical medicine and rehab, and I'd like to know what's an orange idea.
If you look at the orange ideas, you'll see a price increase that is on top of the increase that went into effect on January 1st. Now, some of you might quite naturally ask, well, why don't you just go ahead and make a price increase a green idea? The answer is that today, our prices are already among the highest in the area. And so to increase our prices further would only drive business away from us and hurt us financially. Therefore, we're going to be very careful about this idea, which is why we've classified it as orange. In the long run, we have to be better stewards of our resources, and we'll do that through implementation of green ideas.
Hello, my name is Wally Alatcon. I'm with Internal Audit, and I just want to know what type of initiatives are currently being looked at within supply chain.
The supply chain work group is evaluating how we purchase items that we use on an everyday basis. including office supplies, medical supplies, implants, and medications. A lot of great ideas have come out of this group, and they've already achieved savings of $3 million in this area so far this year. That's great news, because every dollar that we save in this area is a dollar we don't have to save somewhere else. There's lots of things that we can do every day to help with supplies, and one of them is charge capture. Every time we use a billable, chargeable item for our patients, we need to be sure that we're charging for them. This is something that we can all participate in each and every day.
Hi, this is Michael Lombard with Performance Improvement and Transformation. What about ideas for revenue cycle?
The revenue cycle encompasses all the processes involved in charging for our services to patients, billing patients, and doing the collection follow-up. One area that is touched by a lot of employees is charge capture. We need to be sure that we are appropriately charging patients for the services that we render. And like the supply chain, literally thousands of employees touch this process each and every day. So the work that you do here really matters in terms of us meeting the goals that we've set for ourselves.
My name is Adela Sai, and I work in the emergency department. So workforce redeployment, what does that mean?
The Workforce Redeployment Work Group is focusing on one of the most important aspects of budget recovery, which is how we are organized as an organization and how we've organized our work into jobs. One of the things that this group will be seeking to do is to build more flexibility in the way our jobs are designed. A great example of that occurred last summer when our census was low. Many inpatient nurses were cross-trained to provide coverage in the emergency department or in the operating rooms. This allowed them to flex to areas that were busy, keeping us from having to hire additional staff in those areas or to incur overtime. We need to look comprehensively at the entire organization to ensure that this kind of flexibility is built into everything that we do.
My name is Lauren Mirsky-Piatkin from the Child Life Department, and I want to know, how are decisions about job vacancies being made?
Whenever someone leaves the organization, for whatever reason, we need to consciously ask ourselves whether that position needs to be replaced. Can some of the work that was being done by that individual be eliminated? Can we eliminate waste and streamline operations in the department so that the people who remain can continue to provide a high-quality service without replacing the position?
Hi, my name is Willie Powell. I'm with the 7 to 3:30 shift. I'm a team leader on the day shift, and my question for today is, are there going to be changes in my pay and benefits?
We have received many ideas relating to compensation benefits. As you'll see, many of them are considered budget contingencies and are in the yellow, orange, and red categories. We do, however, have some ideas that are considered green. The reason for this is when we look at certain programs, the amount of benefit that we offer to our employees is significantly more generous than what comparable organizations offer to their employees. We are using budget recovery as an opportunity to bring those programs in line with the marketplace.
I'm Tracy Nora from Food Service, and I would like to know, how can I submit an idea?
As you've seen with the dashboard, our green ideas only represent a little over half of what we need to meet our $85 million goal. To get the rest of the way, we need more ideas, and we need them from you. On our ChildNet Budget Recovery website, there is now a simple form for you to complete with your ideas, and they will be reviewed by the work groups for consideration.
Kristen De Santo, medical librarian. What are other healthcare organizations doing?
I recently attended a meeting of healthcare executives from around the country. Not surprisingly, the issue of federal and state budgets was on everyone's mind. The experts at the conference spoke of the fact that these fiscal constraints are going to be with us for the foreseeable future. In fact, they're projecting a fundamental financial restructuring of the industry. One of the things that struck me about this was that even if the current budget issues are not as significant as we think they're going to be, it will only be a temporary reprieve. Our reimbursement is going to go down, and we need to prepare for it. Many hospitals from around the country are preparing for this, and I was encouraged that the work that we're doing through budget recovery is consistent with what other proactive organizations are doing. Over the coming weeks and months, we will implement green ideas, as well as look for new ones to implement. We will report our progress throughout. Implementing these ideas is going to require us to change the way that we do things. Some of these changes will be easy for us. Others we won't like. The key thing to remember is we are doing this to help children continue to do what we do best, which is to serve our patients in need.
Ryan Campbell in the Pastoral Care Department, and I'd like to know what I can do.
I'm committed to keeping you informed every step of the way as we implement budget recovery. I ask that you do everything you can to stay informed, ask questions, submit ideas, and continue to work on the challenges that lie ahead. I know you're working hard, and I appreciate it. Thank you for everything that you do to make life better for children.